The governor said last week that she was really concerned about the way the numbers looked, and she even suggested that if we don't get some of these cases under control, the number of new cases under control, that we might have to make some adjustments here in the state. Do you get a sense where we are today about whether or not we are going nearer to moving forward, or are we in some ways moving backward?
I mean, Rick, we're still in a zone that is concerning to us. And when we're looking at the modeling in terms of how the case counts are changing, how the hospitalizations and things are going in the state of Michigan, we are concerned as we're at a heightened level of awareness and observation right now. I think it's still up in the air as to whether or not we need to take a step back into a different phase. The Grand Rapids area in particular has been an area where we've seen community spread at a pretty high level. But there is something that we can do and that we know works, and that is everyone wearing a mask. Wearing masks is the simplest way to slow the spread of COVID-19. And if everybody masks up, there are a lot more activities that can be available to us in the safest way possible. I liken it to wearing a seatbelt. We strap a piece of cloth across our bodies every time we get into a car to prevent loss of life. If we strap a piece of cloth across our faces, we will prevent the spread of coronavirus at scale, and that will help us be able to engage in much more activity than we were able to do previously.
When you talk about hospitalizations, one of the things that we've been asked from time to time is how many critical care beds do we have in the state? How many of them are occupied? How many of them are occupied by people suffering from the coronavirus? Do we have all of that data?
So we do have it, and it's available at the My Safe Start page, which is our sort of dashboard, if you will. We're looking at the different regions of the state and what their public health and hospital system capacity is and how that compares to how the case counts and the deaths are changing and trending. And that's really important because what this is about, slowing the transmission, one, helps make sure that we don't overwhelm our healthcare system. I saw a headline out of Florida today, for example, that talked about how their hospitals are almost at capacity due to the exploding number of COVID-19 cases. I also want to recognize something that I think is getting a little bit misinterpreted. Hospitalizations are super, super important and super, super critical to understanding. But I don't want people to get sick in the first place. I don't want you to get sick and even have to be at home because you're sick. I want people to be prevented from ever getting COVID-19 in the first place. And that is why masking up is so important. If we do that, we significantly slow the spread, which will mean less people getting infected, which means less people getting hospitalized and less people losing their life.
So as we move into the end of July with a lot of parents like you, like me, looking at our kids going back to school, does this create more uncertainty about what this looks like if we don't get these cases under control? Because I know decisions have to be made by, the plans have to be in by the end of the month, and decisions will have to be made pretty early on, I would guess in August, to get everything in place if we're going to go back to in-person learning.
Well, certainly it's an open question, and I am concerned about this as a parent of twin rising second graders, like parents across the state are. But, look, as part of our My Safe Schools planning and then our Return to Learn Advisory Council that we established in the task force within state government, we asked for school districts to present plans for the state being in phase 3, phase 4, or phase 5. Right now, most of the state is in phase 4 with the Traverse City region and the Upper Peninsula being in phase 5. So every district is working hard and diligently on making plans for all 3 of those phases. So I think we have an opportunity to where the open question is what phase we'll be in, but I expect every district to have a plan that's conscientious, that's working with their local health departments in partnership to make sure that we have something that will work as best as it can for our families, for our children, for our education professionals, for everyone in our communities.
Let me ask you about another somewhat COVID-related subject, and that's the budget. We know that budget presentation and all of the things that we expect from putting together a budget got kind of moved around when this all started with COVID-19 after we started to see what the real ramifications were, the tax dollar implications, what it means to the budget. The legislature and the governor apparently have come to an agreement in principle on what this may look like. Do you expect this budget process to get wrapped up in the next week or two, or are we looking at another month or so?
Well, we certainly want to wrap it up as quickly as possible so that school districts and local units of government can do the planning that they need to do because they've been hit hard as well. And I think that that's going to be a question for the Republican legislature. If they're ready to come and work with us, which I think we've been working together quite well to try to solve these problems, because everybody recognizes that in this moment, we need to make sure that we're taking care of the people's business. And I expect that to continue. And so I'm looking forward to us wrapping this up as quickly as possible. I would love to wrap it up in the next couple of weeks. You know, the legislature is in session tomorrow. I will be up there presiding over the Michigan Senate tomorrow and Thursday. And we're hoping we can get this business done for the people as quickly as possible.
All right, Mr. Lieutenant Governor, I'm going to break you out of here. I know you got something to do in a couple of minutes. I thank you for taking time to do this morning.
Thank you, Rick. You stay safe. And for all the listeners and viewers, you stay safe as well.
Do the
Mask
same.
up, Michigan.
Thank you.